Okay, thanks everyone for taking the time to join us. Today we have SHA CEO Scott Livingstone and Saskatchewan's Chief Medical Health Officer Dr. Saqib Shahab. As well from the SHA we have Derek Miller, the Emergency Operations Center Commander. We'll have opening remarks and then we can move to questions. Scott?
Me first today?
It is.
Okay. So before I begin, I'd like to convey my condolences to those families and loved ones who experienced the death of a loved one due to COVID-19 in the last few days. I'd also like to convey my gratitude to healthcare workers across the province. We're nearing that 1 year mark for the pandemic, and I am truly thankful for their leadership throughout this difficult time. Today I'm here to share some news about two recent developments which will help us expedite vaccine distribution province-wide. As you probably heard from other media, we are moving forward with a 4-month window between the first and second doses of our vaccines. This is based on increasingly strong evidence that first doses are effective. As an example, and I've mentioned this before, as you've seen cases in our long-term care homes and personal care homes increase or plummet dramatically since we've started vaccine. I think just before Christmas we had 200 plus infections in long-term care residents, and today it's a dozen or so. So we're seeing the benefits of that first dose and second dose take effect in our population. This is good news, and it's being seen in other jurisdictions around the world. Previous to this decision, as you know, we were far short of the doses needed to finish a phase 1 by April of our vaccine program. Now we expect to substantially complete phase 1 in early April. This is great news, and more vulnerable people will now get the protection from the vaccine they need sooner. The other good news, as you know, is the introduction of the AstraZeneca vaccine. Saskatchewan seniors aged 60 to 64 and phase 1 priority healthcare workers will be offered 15,000 doses of AstraZeneca vaccine starting March 22nd. Making vaccine available to 60-64 age group is being done as an exception to phase 1 criteria to align with the National Advisory Committee recommendations that AstraZeneca be supplied and targeted for those under the age of 65. Both eligible healthcare workers and those 60 to 64 will be provided information so that they can book appointments in the upcoming weeks, and we will provide more information on how that's going to work in the days to come. While this is very good news, I do want to ask for patience from the public on a number of things that we're working on to adjust the implementation of the second dose changes as well as the introduction of the AstraZeneca vaccine. First, by extending the interval between doses, it has implications for some of the automated systems that we have built for our mass immunization program, because it was allowing for the booking of second appointments, which now is a fundamental change in the system, and we're working with our vendor now. And we'll have that done quite quickly so we can launch the online booking system for patients across the province soon. So once we start moving forward with this over the next week, there might be a few wrinkles in the call out for vaccines, and I hope the public will have some patience with us while we move through those changes. The decision to move forward with this recommendation with the National Advisory is truly the best use of the AstraZeneca vaccine as based on available evidence. We'll do our best to ensure that the public is clear that this exception to our phased rollout, as well as access to other vaccines as they be coming online in the months to come. We'd also like the assistance of the media and the public on helping us pass on relevant information as we make announcements throughout the next few weeks. In order to introduce these changes, as I said, there may be some small delays in vaccine arriving or vaccine getting into arms, but these are short term, and I'm talking a couple of days here and there. They're not weeks at a time. For a combination of safety reasons, we do need to change our systems to accommodate both the 16-week change interval as well as the AstraZeneca vaccine, because our system was built primarily for the Pfizer and Moderna vaccine. We expect this, as I said, for a very short period of time. As we move through phase 1, we continue to wait on vaccine supply to provide vaccines across this province. And I want to thank the thousands of healthcare workers today that are involved in our vaccine program, as well as those individuals that are being patient with us as we allow for booking appointments as vaccine supplies allow us. I'd also encourage everyone to continue to make every effort to reduce the spread of COVID-19 and to remind folks that any vaccine is the right vaccine. And we will see additional supplies later on in the summer as we move through phase 1 and phase 2 of our vaccine program. Thank you.
Dr. Shahab?
Thank you, Scott. So I'll maybe just reinforce some of the points which have already been made. But starting, I'll again offer my condolences to the family and friends of the 4 Saskatchewan residents who have passed away due to COVID-19 since Tuesday. And like Scott, I think it's my sincere hope that today's decision to advance the vaccination rollout, both by extending the second dose as well as the addition of AstraZeneca, limited amounts now, but in the future, greater amounts of AstraZeneca and possibly Janssen also, will further accelerate our vaccination program. And across the country, I think we have all agreed that this ability will then reach us closer to actually getting all adults 18 and over fully vaccinated by June, and then of course second dose will start as well. Like Mr. Livingstone mentioned, this transition will to one dose will start with residents, with appointments being made tomorrow, but residents of long-term care facilities and personal care homes will still complete the second dose. I think it's just, I don't want to repeat all the points made, but I just want to re-emphasize that, this really, about 12 months ago, we did not know when the pandemic will end, and most people thought 24 months. And this really, now we are looking at maybe 12 weeks, and we could start coming out of it. But what we do need to do, as Mr. Livingstone emphasizes, that we all need to be patient. We need to be ready in our minds that when our turn comes, we should be ready to get vaccinated. It is my recommendation that we accept any vaccine that's available. But of course, if for some reason people want one product versus another, it may not be available at that time, and they may have to wait a bit longer. But in other countries where the vaccine program has been successful, all the vaccines have been used in a way that people are getting a vaccine that's available at the point of delivery. They're all safe and effective, and with this ability to offer one dose to everyone 18 and older now, as we become eligible, initially 70 and older, then 60 and older, I think I can't stress enough that we all should be ready to, at short notice, learn that we are now eligible based on our age group and be able to take up that vaccine. All the indicators that I'm seeing is that vaccines will be coming through fast and furious starting end of March, April, and very quickly 50 and older will be eligible by as early as May, and then by June everyone 18 and older. So I just want to emphasize that we all need to play our part in making sure that we get immunized as soon as it's available, but also most importantly we continue to practice all our public health measures till such time as diligently as possible, because that will enable us to keep our case numbers as low as possible. That will result in preventing further loss of life, reduced pressure on hospitalizations, enabling the health system to focus on other urgent and elective procedures, but then also enable the smooth delivery of vaccinations throughout Saskatchewan. Thank you.
Thank you, Dr. Shahab. We'll now move to questions. We'll start in the room. Arthur?
There's been a pretty steady downward trend in terms of hospitalizations over the last few weeks, and I'm just wondering whether we're yet able to say if that is connected to the vaccination program thus far. Are we seeing fewer hospitalizations because we now have older people vaccinated?
So I think I'll give my initial comments, then Scott and Derek may want to add. So certainly even here in Saskatchewan with, we are, in my view, seeing a definite impact in terms of reduced cases and outbreaks in long-term care facilities. And that's easy to measure because beyond that, I think our vaccination numbers are now picking up in 80 plus and 70 plus, but it'll take about 6 weeks for those numbers to pick up in terms of, we hope, the vast majority of people in those ages getting vaccinated. It does take up to 3 weeks for everyone to be, get their high level of protection from a single dose. So, and that's why, we all have to observe the public health measures so we reduce exposures till we are all fully vaccinated. And the other thing I'd just like to emphasize is that, a lot of people 50 and older have been shielding themselves very successfully throughout the pandemic. We've seen always seen high rates in 20 to 40-year-olds. Younger adults are more likely to be out working in more frontline occupations, more likely to be exposed otherwise socially. The rates in 50 plus have been lower, especially 60 plus, but unfortunately rates of hospitalization and death have been proportionally much higher. But I would say at this point we're already seeing the positive trend, but that only reinforces the need for a quick deployment of the vaccine program, age-based, but then really hope that people come forward when they become eligible based on age and don't delay, because once eligible, you're always eligible. But I think it is important to come forward earlier rather than later to minimize your risk of exposure so close to the finish line. And I don't know, Scott, if you and Derek have any comments.
So the only thing I'd add, Arthur, is I do think that we've seen some early signs of reduced pressure on the COVID side in acute care, but I think it's really too early to say that it's directly related to vaccines, simply because we haven't, although we've gotten to, the long-term care and personal care homes now, has certainly seen a dramatic drop in outbreaks and the number of positive cases and hospitalizations for those individuals. We still have pressure on the system for other non-COVID, and as well, just to remind folks that, to Dr. Shahab's point, with the variants of concern out there in the province, and the new testing that's coming available, and the expanded testing capacity at our provincial lab and at Royal University Hospital and PAVIC with some new equipment. We hope we'll see more tests, and we hope we will find more positive cases, because we know they're there still. If they weren't there, we wouldn't see outbreaks in schools. We wouldn't be seeing outbreaks in some of the daycares and such like that. So I think it's still important to follow all the rules. I think the vaccine has definitely given us that definitive tool in our toolbox that's going to get us out of this, but I think it's early days for acute care. And I think we're yet to see some additional pressure just because of the variant being out there. And it's a race right now against time that Dr. Shahab talks about, as quickly and as soon as we can vaccinate, the better off we're going to be with respect to coming out of, if there is a next wave of cases in that younger group of individuals that have yet to be vaccinated.
Yeah, one comment I just want to make is that as the variants of concern are, in Europe, certainly they're becoming the dominant strain. Even in some states in the US and some provinces, they are gradually increasing. Proportion of COVID strains that are variants of concern is increasing. And because the B117 is more transmissible, what we are seeing in other jurisdictions, not in Saskatchewan so far, is that you may see decreasing hospitalization deaths in elderly who are getting vaccinated, which is great, but you may paradoxically see increased transmission rates in the younger population. And although the variants of concern may not be more lethal, but because more people are getting infected, there has been some signals in some other jurisdictions, not so far in Saskatchewan and not so far, I think, in Canada, but certainly in Europe, of increased hospitalizations in younger age groups. While we know that hospitalizations are less frequent in under 50, they do occur, and unfortunately deaths also occur. So I think that this just speaks to that the next 3 months are really important, that we all maintain our public health measures, keep our numbers low through those measures, and we all step forward to get vaccinated, because I think that will really serve us well as we enter the summer.
There is a timeline that I've heard in terms of when people in those younger age groups might be able to get vaccinated. You talked about we'll have people 40 to 50 getting vaccinated by May and might even get 18 by June. Once we get to the summer and we have all vulnerable people that are disproportionately impacted by this illness vaccinated, can you paint a picture of what you think life might look like in the province in terms of restrictions, in terms of public health guidance? What do you foresee, just to give people a sense of what they can look forward to once we reach those stages?
Yeah, so I think this is an important question. I don't think I can give a comprehensive answer right now. But what I can say is that on the one hand, we still need to be cautious, because the UK had just exited its second wave, and they were actually doing victory laps because they had just started their ambitious vaccination program in late November, early December. And then they saw a devastating third wave, partially impacting people who are not vaccinated in the older age groups, but the vaccination was moving ahead, but also younger populations. So I think we need to be cautious over the next 8 to 12 weeks overall. But certainly all the data we are seeing right now shows that, and that's especially from the UK and Israel, who has now started reached a majority of its 18 plus population through vaccination, is that absolutely as greater numbers of 18 plus get vaccinated with one dose, COVID rates start falling. What does that mean for individuals who are vaccinated? Do they have to observe public health measures? I think we will have better answers in about 8 to 12 weeks. But definitely, I think if your entire cohort, the people you socialize with, are vaccinated, the risk of transmission is much lower. What does it mean as a societal level? I think on a positive note, we're entering summer at the same time as we are getting fully vaccinated. Summer, we hope that transmission risk would be lower anyways. Outdoors activities will be more common than indoors. So we expect to see a good summer, maybe with less restrictions than even last year. Last year with very low case numbers. Hopefully this year we would have less restrictions. Hopefully if we can reach June with a higher vaccine uptake and low overall case numbers. But the important question is what does it mean for the fall? And again, we would like to think that we would emerge from the pandemic by the fall, definitely, or by even early summer. But I think there will still need to be some precautions for people who, for some reason, couldn't get vaccinated. And, but I think what does it mean in terms of how large of a gathering we have in the summer and the fall? I think those are all important questions. We will obviously be looking at how effective the population level protection is. And I think, signaling some potentials of relaxation of some of the broader public health measures. But again, I think other countries who are a bit ahead, 2 to 3 months ahead of our vaccination program, like the UK, will be looking closely at how they do. They've already announced their reopening plan till June. And by the way, actually, they're thinking that if they have their large venues, they may use, even though the population is vaccinated, they may use point-of-care testing also as an additional tool, and maybe tracking apps, which may also serve an additional purpose, even though the overall risk would be low. But just to streamline and further minimize any risk, testing and COVID tracking apps may still play a bit of a role over the summer and early fall. But certainly, I think that sharp edge of the pandemic, the risk of a spike that overwhelms the health system, I really hope we'll be out of that by June.
We'll take a question on the phone.
We have Stephanie Taylor with the Canadian Press.
Dr. Shahab, what are the risks, if any, of extending the second dose or delaying the second dose up to that 4-week mark?
Yeah. So I think we have looked at this very closely, both in Saskatchewan and in other provinces and in Canada, as well as other parts of the world. So as you know, safe, effective vaccines were licensed, Pfizer and Moderna, in December. At that time, it was a 3 to 4 week schedule, very strict instructions about handling. You couldn't move it more than a few feet away from the freezer. Since then, the handling characteristics have improved. We can handle Pfizer and Moderna much more broadly. AstraZeneca is a fridge-stable vaccine. We extended the second dose interval to 42 days in January. And then that made it easier for the logistics part. And then now that we have data from the UK, which always had a 3-month second dose program, and from Quebec, which started with the 3-month program, and research from BC, that's showing that the immunity from the first dose continues well into the 3rd and 4th months. So from that perspective, I would say that there is absolutely minimal risk of extending the second dose to the 4th month. And the benefits are tremendous. We can emerge out of the pandemic 3 months earlier than we had anticipated. With a 2-dose program, it would have taken us till September. Now we can vaccinate everyone 18 and older as early as June. Having said that, everything will be monitored closely. All provinces will be closely monitoring. Are there any signals of concern with the extension of the second dose program? Are there any signals of concern in jurisdictions where variants of concern are taking off? That may need a readjustment again of the program, because again, I have to stress that all decisions are based on science and evidence. And if there's any reason to revise that, that will happen as well.
Follow up, Steph?
What specific restrictions are you looking at loosening as soon as next week, either in terms of what might actually come off or a plan that the Premier has alluded to? Because I think a lot of people are feeling the news of the optimistic news coming out of today, but they also see that we are hovering around 150 new cases on an average basis, and that still is a cause for concern. So what restrictions are you looking at loosening?
Yeah, so I'll maybe make some initial comments, but I think then we still need to wait till next week for some decisions. But, on the one hand, I think, we have done fairly well because we have managed to keep most sectors open throughout a second wave, and it may have taken us longer to come out of it, but restaurants were open, retail was open. You could do many things, albeit with some very specific guidelines that have served us well. I know it's been very hard for people not to be able to meet each other in their houses. So, in the past we did have, 2 to 3 households as a bubble of up to 10. So that's something that we're looking at carefully, that is that something that may again be, a safer option to allow. But I have to emphasize that even there, we are at fairly high transmission rates that's unevenly distributed in the province, fairly low in the south, low in Saskatoon right now, a bit moderate in Regina, coming down in the far north and north, but not that low. And that's why that even if there's some relaxation of restrictions, I think we all need to continue to do our individual risk assessment. I think if you are, a person who's 70 and older, 60 and older, 50 and older, your risk is higher. You really should continue to shield yourself and really, meet and greet friends and relatives outdoors. Think of getting vaccinated as soon as you're able to. And because I think those things will still be important. But beyond that, I think other things that can be relaxed, we'll be looking at that obviously in a 4-weekly cycle. The current order is till March 19th. So we'll have to look at that carefully in terms of what can be relaxed based on our case numbers and risk. But at an individual level, I think, we need to be, people have done so well for the last 11 months, 12 months. And I think it would be unfortunate if we were to get exposed so close to the finish line, especially if we are individuals who are older or have higher risk factors. So irrespective of what the restrictions are and how they're relaxed, I think we all need to just take special care for ourselves if we are in the high risk category, and for others, family, friends who are in the high risk category, to shield themselves till they're vaccinated.
Next question in the room, Mark.
What's the level of protection for that single dose from Pfizer, Moderna, AstraZeneca? And is there any concern that those over 70 people only receiving one shot might not have the level of protection they need?
Yeah. So, the clinical trials, when they were done with a 3-week or 4-week period, and in trials you try to maximize the outcomes to get positive results. But what we've seen in real world conditions, in, for example, the UK, Scotland, Quebec, and research on the BC CDC, is that after the first dose, the level of protection reaches 80%, and that keeps increasing. And obviously, we still recommend a second dose. And there is indications that if the second dose is given at any point, like 3 months, 4 months, that will likely give a booster, which will extend the level of immunity. But certainly all the evidence is showing that even one dose in all age groups provides a high level of protection that continues at least into that 3rd and 4th month.
Follow up, Mark?
Forged Fitness, a gym in Martinsville, says it was told by health officials that it was an outbreak there and all members needed to self-isolate. What can you tell us about that outbreak, and why were the members needed to self-isolate versus self-monitor?
Yeah, so I don't know the details of that specific thing, but I think that's a really important point that, public health always works with, business owners, other settings when there's an outbreak. And so if you are closer than 2 meters without a mask and for more than 15 minutes, or maybe you're exercising or breathing heavily, or there are other things that would denote a high level of exposure, you're considered a close contact. And then you have to self-isolate for 14 days, as well as seek testing. If you were like in this room, if one of us developed, COVID, after the fact, public health will investigate, and they'll probably say to me and Scott that you have to isolate for 14 days, but everyone else has to self-monitor because you're further away. So I think, sometimes that case-by-case determination has to be made. But I think some of those guidelines are also being reviewed because of concerns with variants of concern. So some provinces have already tightened the guidelines that even though case numbers are coming down, there seems to be a higher risk of transmission with variants of concern, even with all the current public health measures that we are using. So in some cases, the guidelines may get a bit tighter, which does put a bit of a stress on people because they have to self-isolate, not just self-monitor. But generally, I think public health right now is keeping on top of all case content investigations, and their advice is based on that case-by-case assessment.
We'll take another question on the phones.
We have Laura Fomanov with CKOM.
Registered nurses in this province are being sent letters asking, those who aren't certified currently are being asked to recertify their qualifications to help with immunization clinics, but it costs $700 to get that recertification. Will the SHA or the province cover that cost for them?
Laura, that's a good question, and I don't know what the answer is, but I'm assuming that we would if we're asking them to join the immunization strategy. And I know we are inviting nurses, retired nurses, nurses that are former public health nurses to join. If they are being recertified at ours, I'm assuming we are, but I will follow up with the HR team and get you a specific answer.
Okay, thanks, Laura. We'll follow up on that one. Do you have a follow-up question?
I do, and it's on a different topic. Some people, including the former CEO of Vito Intervac, are concerned that there's not enough information at this point on the length of immunity after the first dose of a vaccine, COVID vaccine, is administered, especially against the new variants there.
Yeah. So if I understood the question, there's not enough information on the immune protection, especially against variants of concern.
The length of immunity, not that it doesn't protect you, but how long it protects you.
So as per the NACI guidance, I think there's two things. One is that the current evidence does show high level of immunity for up to 4 months, but obviously this will be measured closely in an ongoing fashion. And if there's any signals of concern, the guidance may change. It may pull the second dose earlier, or other measures may be needed, but certainly everything will be monitored very closely. Regarding variants of concern, again, there's emerging evidence that the predominant variants of concern right now, which are taking, picking up in Canada, are the B117, which is the UK variant. All the 3 vaccines provide good protection against that variant, but I think that is something that we will again have to monitor closely. Again, right now, I think the data we have says, as soon as the vaccine is available and you are eligible, a vaccine in the arm is better than no vaccine, a single dose. And then when eligible, a second dose provides longer-term protection. But over time, I think these questions will have to be looked at closely, that over the longer run, what is the impact of variants of concern? How long do 2 doses confer immunity? Will the pandemic end totally, or will we have low levels of COVID transmission, and will we require, or will people who are more susceptible require a booster shot sometime in the future? I think those are all questions that will be looked at closely going into the future. But the other thing I would also emphasize is that while there may be some residual risk with extending the second dose, the benefits are enormous. The fact that we can provide a population level protection 18 plus within approximately 3.5 months, I think, are huge. So I think we need to look at the benefits as well as potential challenges, which we will need to monitor closely as well.
Take our next question, Adam.
What's your message to people that see the stats of the AstraZeneca vaccine versus Pfizer versus Moderna and say, okay, Anthony, you mentioned in your opening comments, I prefer this vaccine over the other one. Can you tell people what kind of protection they'll be getting and why they should just take, as you say, whatever vaccine becomes available to them?
Yeah, so maybe I'll make some initial comments. And so I've talked to my friends and relatives in the UK, about 9 of them who've gotten vaccinated, and some of our healthcare providers, some are people in the population who became eligible. They just showed up. They didn't know which vaccine was available. They got whatever vaccine was offered. So some got AstraZeneca, some got Pfizer. At the point of delivery, the provider either had one or the other, not both. So my recommendation really is that, please accept the vaccine that's available when you are eligible, and I would do the same. At some point in the future, there may be a choice or there may not be. But I think at this point, it's so vital to, get protection as quickly as it is available that I would strongly recommend any of the 3 approved vaccines in Canada are safe, effective, equivalent, and we should, accept whichever vaccine is available. But of course, if people wanted a specific vaccine, they may have to wait a bit longer. There's no guarantee that it may be available even at a later date because, the supplies are very, we know what the overall supplies are, but the logistical distribution is also, where Moderna goes, Pfizer doesn't go, and AstraZeneca is increasing in volume, but, it remains to be determined how that will be provided, and in future Janssen as well. But at this point, I think it's really important to accept the vaccine that's offered and available, and they're all equivalently safe and effective. I don't know, Scott, if you...
And the only thing I would say, Adam, is that, like I said before, the right vaccine is the vaccine that's in front of you. And I think to Dr. Shahab's comments around clinical trial evidence, given the expedited process that ensured safety and efficacy of these vaccines that are available to us, the real world evidence is speaking to us across countries, and I think yesterday both Germany and France approved AstraZeneca for 65 plus based on the real world evidence that they're seeing with the vaccine. So understanding that some people might want to make that choice, but that choice will be limited because of vaccine supplies in the early days. And it would mean potentially that they would wait longer for the vaccine that they choose. But certainly at near, post June and where there's lots of vaccine on the horizon, even after the first doses, there would be more types of choice. But in the early days, we're highly limited, and that 15,000 doses of AstraZeneca is a welcome, surprise. But it has a limited, there's only 15,000 doses. Right.
Can you speak a little bit about the second dose and how that's going to work now? I think you mentioned that we're looking at September, maybe now we're looking at June for the first dose. What is our timeline for that second dose, and how are you going to talk to people about reminding them, okay, you got the first dose, this isn't over, we need the second dose, the reason why. Are we expecting people that are done by June to get a second dose by December? What's our best guess right now?
Sure. So just to start out with some of the logistic issues around second dose is part of the online booking system is also including an algorithm that allows to book the second dose, not just the first dose, and that would be the same for the call-in line. So those are one of the changes we're making because of this new 16-week stretch. The other thing to remember is it's going to be based on available vaccine, but we do believe that at a 16-week interval, there'll be lots of vaccine to give people their second doses. And if we do, like we believe we can, get done in early June, we don't have to wait 16 weeks for people to get their second doses because there will be lots of vaccine to do that. So I think 16 weeks, as we're talking today, is sort of that outside measure, which gives us the ability, as Dr. Shahab has said, to escalate the program and get more people protected quicker because of the first dose. But that 16-week is an outward number right now, and as vaccine supplies will continue to flow to the province in July, August, September, November, we will be able to get those vaccines in people's arms quicker, likely as long as we're getting those first doses first. And again, everything I've said is dependent upon vaccine supply to the province, but at this point in time, we're optimistic for sure with phase 1 and starting phase 2 early with the supplies that we're seeing on the horizon, but those second doses I don't think are going to be a challenge at all.
We'll take a question on the phone.
We have Lisa Schick with CJME.
Hi, I'm just wondering about the, I guess, how the AstraZeneca vaccine is going to roll out. I mean, are there going to be a certain number of those 15,000 doses set aside for people in their 60s and then some for healthcare workers, or is it the people in their 60s are going to get any vaccines left over after those first priority healthcare workers get it?
So that's a good question, Lisa, and the plan is that the booking of appointments for the AstraZeneca vaccine will open at the same time for the healthcare workers in phase 1. And in age order for the 60 to 64-year-olds meeting, we would start with 64, So as an example, the plan would be on March 15th to open up bookings for healthcare workers and individuals that are age 64 to book appointments for the AstraZeneca vaccine. Like we've experienced early on in the pandemic, demand will outstretch our supply. We have 15,000 doses and we have much more people in that 60 to 64 category. So as we book appointments and those appointments fill up to the 15,000 number, we will close the booking and then move on the next week to administer the vaccine.
Follow up, Lisa?
Yes, I'm just wondering, what do you say to people who are in that 70 plus category who might be frustrated that a person in a younger category could be getting a vaccine before them?
I can maybe
Go ahead.
Yeah, so I think on the one hand, AstraZeneca in the UK is approved for all age groups 18 and older, and so it is in Canada actually. Health Canada has approved AstraZeneca for 18 and older. I think because NACI did give a professional recommendation at this time, that may change, that AstraZeneca preferably used for 64 and under. So we just abiding by that. It is only 15,000 doses. We're getting it and using it. We don't want to say no to that. So obviously it is a bit of a blip in a younger age category. But I do want to say that vaccines are coming really fast and furious, and I think all of us will be eligible much before we thought we would be. So 70 and older, April, and then towards the end of April, 60 and older, and then towards the end of May or mid-May, 50 and older. So it is only a matter of weeks now. I think the landscape has changed dramatically.
So I just have a clarification on Laura's question around the licensing fees for retired nurses. So Laura, if you're still there, the clarification on your question is that we have been working with the SRNA around the registration fees for people coming in to do immunization. It's not clear whether or not there actually will be or not as we're working through that. If there are any fees associated with registration, the SHA will be covering those fees on behalf of the individuals that are doing it and have helping us out with the immunization program.
Thank you, Scott. We'll take our next question on the line.
We have Roberta Bell with Global.
Hi, my question is regarding children and teenagers. I know you kind of mentioned that there might be some hope for getting 15 and over vaccinated within the spring, but what kind of timeline are we looking at for vaccinating people under the age of 15? Do we have any indication about when that could start happening?
So all the vaccine manufacturers are currently conducting trials in children. As we know, because COVID impacts the elderly more seriously, the initial trials focused on adults and elderly, and so they showed a high benefit, and so the vaccination. But trials in children are being conducted, and obviously, and I have to say, the 3 vaccines that are approved in Canada have shown that all 3 reduce hospitalization and death by 100% in the trials. So all 3 vaccines have shown in the trials to prevent hospitalization and death by 100%. So I think that is a remarkable statistic. But in children, of course, we know that children get mild illness for the most part. Thankfully, adverse outcomes like hospitalization and death are rare. But the trials will be being conducted to look at safety, obviously, efficacy, and they may use other endpoints, clinical illness or other serological endpoints to show that we expect the vaccines to perform as well or even better in children. There's no reason why they shouldn't. But they're just doing those trials as we speak. But we will await the recommendations of NACI about how should vaccines be used in children, and I think those should be expected over the next weeks to months.
Follow up, Roberta?
And my next question is unrelated, sort of, regarding how you think that the system is going to handle opening on March 15th was the original date, I think, that we had there, but the sign-up vaccination system will cope with all of the changes that are coming in the boom that you might expect on that day.
So we have been actively watching and testing and putting in place contingencies to ensure that both the online booking system as well as the new telephone line that is separate from 811 will have the capacity to manage the influx of calls. We are working as well on a strategy to gradually increase eligibility so that not everybody calls at once, but to give you some ideas on the online booking system, some of our performance testing is looking at a capacity of booking 1 million appointments per hour, which is well in advance of what we likely will see. But at the end of the day, we are working on contingencies for both because of some of the experiences in other jurisdictions. But we're confident that at this point in time, we've done all the mitigation we can, and we've got to let the system move forward and test it in real life.
We'll come back to the room if there are any additional questions.
Mark? How's the priority list arranged to dole out the leftover vaccines that say there's extra in a vial and they have no one left on the list? How are you doing those out?
So I think, he's been quiet on the other end of the line, but I think Derek Miller is with us from our emergency operations center, and Derek would be able to speak to the protocols and the directions that we've been providing the immunization team. Derek, do you want to answer Mark's question?
Yeah, Scott, if I heard correctly, it was about our process for if there's extra vaccines available at the end of a shift and after working through the booked appointments.
That's right.
There is a work standard that's in place and that each of the clinics will follow, whereby they will have people available on standby that still meet the eligibility criteria that could come in order to receive those remaining doses. And beyond that, there's always the ability to do peer-to-peer immunization if there is no other way to use up those extra doses. Obviously, we don't want to be in a position where we're wasting any of the vaccine. Typically, those numbers would be very small because as long as you haven't actually punctured the vial, then you're able to save it for the next day. So that process is well in hand locally.
Perfect. Thank you, everyone. And that concludes today's conference.